These are examples of efforts that show we don't need to reinvent the wheel. You're already figuring out what works to reduce infections in hospitals or help patients with complicated needs. What we have to do is to share these best practices, these good ideas, including new ways to pay for care so that we're rewarding quality. And that's what this network is all about. In fact, just 5 years in, the Affordable Care Act has already helped improve the quality of health care across the board. A lot of the attention has been rightly focused on people's access to care. And that obviously was a huge motivator for us passing the Affordable Care Act, making sure that people who didn't have health insurance had the security of health insurance. But what was also a central notion in the Affordable Care Act was we had an inefficient system with a lot of waste that didn't always deliver the kind of quality that was needed, that often put healthcare providers in a box where they wanted to do better for their patients, but financial incentives were skewed the other way. And so the work that we've been able to do is already spurring the kinds of changes that we had hoped for. It's helped reduce hospital readmission rates dramatically. It's a major reason why we've seen 50,000 fewer preventable patient deaths in hospitals. And if you want to know what that means, ask Alicia Cole, who suffers, Alicia's right here, who suffers the long-term effects of a hospital-acquired infection. And she's here today because she doesn't want anybody else to endure what she has. And it's preventable if we set up good practices and financial incentives, reimbursement incentives are aligned with those best practices. So making sure that the Affordable Care Act works as intended to not only deliver access to care, but also to improve the quality of care and the costs of care, that's something that requires all of us to work together. That's part of what the law is all about. It's making health care coverage more affordable and more effective for all of us.